A big warm welcome after the lunch break. I know it's not a very good time to speak here in front of you, but I'll try my best to be as interesting as possible. So thank you for coming back and joining me. The topic which I have chosen for today is very, very close to my heart. Modifying yoga to suit the patient. I have been fortunate enough to be trained with Guruji BKS Iyengar, and he is more popular abroad than in India, simply for the simple reason that it was Lord Menuhin who took him abroad to America and popularized Iyengar yoga. And we know the mindset of the West. Whenever they see a good thing, they grab it. And we Indians, we keep staring. And then when it gets endorsed from there, and then we start appreciating, and we think, why didn't I appreciate it before? So it's the same thing happened with Guruji Iyengar. So we've been talking from morning about yoga experiences. And I also would like to share the same thing, that I am here in yoga not because I have learnt yoga, not because I have studied yoga, but because I have experienced yoga. I know it sounds very high and technical and the correct thing to say. But in my case, what happened was I was always doing the yoga exercises. I won't even call them asanas, because at that young age of 13, I didn't know the difference between asana and exercise. And I come from a very conventional background. And the only thing I knew how to keep myself fit without enrolling in a gym and without making it very expensive was doing yoga. So I would read some yoga books and start doing those exercises and try to get my tummy in and stuff like that. And I continued like that for many, many, many years. And when the gyms came into vogue, I also joined gym and I managed to keep myself fit. At least I thought so. Till a time came when there were certain things going on. I was having certain personal problems. And one day my back just caved in. I was experiencing excruciating pain. So much pain that I could not even stand. And I also did the regular rounds of going to the orthopedic. And they did an MRI on me. And they put me under traction. And they gave me B12 and all sorts of things. I became better. And lots of rest. After 15-20 days, though my pain was not excruciating, it was still intense. And I realized that my life had just come to a big full stop. I could not do simple things like standing and cooking for 2 hours for my children, or even going for a little a drive to maybe from one part. I come from Chennai, so I'm in Nungambakkam. So from Nungambakkam to Adyar, I could not go. That's about a 30-minute drive. And then I started questioning myself that is this the fitness I was priding myself in? I was a physical wreck, I was an emotional wreck, I was also a mental wreck. That's when I was introduced to Iyengar's yoga. And that became a turning point in my life. And that is why I said I have experienced yoga. And this picture is what you see has been taken with Guruji in 2014 during the last years. And you can see that he's still there with his, those underpants kind of thing, which he was very famous for. And he's still practicing yoga there in his room. Okay. Iyengar yoga has been always associated with a lot of props. And Guruji has a lot of people who tell him that he only uses prop. He doesn't do yoga the conventional way, the way Patanjali intended it to be. That is not true. The truth is that props were used just to help people, to enable people. Because everyone does not have the required fitness, physical and mental, to be able to go into a pose the way it was intended to be. And my question to all of them is, who does not use prop? Don't we take a car and a bike when we want to go from point A to point B? Isn't that a prop? Do we say that, no, I'm going to walk it all up? When a child is born, we give when the child becomes about 7, 8 months old, we give the child a walker. Why? So that he learns how to walk without falling down, without scraping his knees or without banging his nose into something. So but the moment the child learns how to walk, we take off the walker. We don't keep the walker there confined. So that is the use of a prop. But Iyengar, it is only for a short time. It is weaned away when the practitioner is able to manage with his own self. So that is very important to have a prop. Sorry. A quick history about BKS Iyengar. It will be incomplete to talk about Iyengar Yoga without talking about him. So he was born on 14 December 1918, and he was invited by his brother-in-law, Krishnamacharya, of the Krishnamacharya Yoga frame in Chennai, to come and be a part of his teaching. And in 1935, when he was newly initiated, Guruji made the first mistake of doing Hanuman Asana. And he writes this in his book, saying, why was it a mistake? Because he had not prepared for the asana. And that was his first learning, never to get into an asana without preparing for it. And he mentions this specifically, and that's why I put it up on the slide. After 3 years of practice, he started seeing the result on his own body because he was a very sick child, very, very sick. And then he got married to Krishnamacharya's sister, Srimati Ramamani, and then she became his guiding mirror. If you notice, it's written the guiding mirror. Why? Because the mirror tells you your flaws and your strengths. Because Iyengar Yoga is so much about precision and alignment that unless you have someone right in front of you, you're not able to see what mistake you are making. And the human mind keeps repeating those mistakes, and the mistakes keep getting bigger every time you practice. The turning point came in 1946 when he and his wife had a divine dream, and they dreamed that Iyengar Yoga is going to go and reach everyone across the globe. And that's when he met Lord Menuhin, and then there was no looking back. There are certain salient features of Iyengar Yoga which I would like to highlight here. If we look at the Ashtanga system, we talk about the yamas, the niyamas, asana, and then pranayama. Most of the schools of yoga, they talk about asana and pranayama in the same breath, or even sometimes pranayama. But Iyengar firmly believed you cannot breathe if your lungs have not opened out. It was a very simple statement, a very profound statement. It's like trying to put something in a closed bottle. So first, when you want to breathe air, you open out your lungs. And most of our people, the way the postures we carry, our lungs are like really closed and drooped. So the first thing about Iyengar Yoga was asana and then only pranayama. When we were trained with Guruji, we had to do asanas for 2 long years. And the word pranayama was never spoken also in front of us. After 2 years, we were introduced to pranayama. That's the kind of rigorous training we were getting there. Of course, I mentioned alignment, props. The beauty about Iyengar Yoga is it builds on itself. It is self-corrective. As you start putting your focus in each and every part of your limb and each and every muscle, the way your trainer tells you or your teacher tells you, you start feeling the difference. Your body starts responding. Earlier, Dr. Ananda said, wherever there is focus, there is energy, which is so true. Because your focus is on your body and you feel the energy, you feel what your body was intended to do, and you start aligning yourself. So that's the self-correction. And then when self-correction happens, transformation happens. So what was somatopsychic then becomes psychosomatic. So from the body, we have gone to the mind, and from the mind, again, the benefits have been passed on to the body. Because when you pay so much of attention to one part of your body, what happens? In Iyengar Yoga, if you do a simple pose, it's like look at your left toe, see whether it has spread, elongate your left toe, now come to the next toe, then look at your knee. These are the kind of instructions which happens on a daily basis. Can anybody think anything else other than toes and knees at that time? So what have we done? By default, we have arrested the mind and we are not allowing it to stress. We've arrested the mind, so it becomes a meditation in action. The two key words which I remember Guruji, which always he used was action, reflection. Action, reflection. And that was the basis of Hatha Yoga, because Hatha Yoga means Ha is the sun and Tha is the moon. We all know that. So the sun is aggression, moon is quiet and passiveness. And that's how he brought in the concept of Hatha in his practice. So what all can therapeutic yoga, Iyengar style, do? So these are lots of diseases right in front of you, which we treat here, there at Orange Ray at the center. From low back pain to disc prolapse, to sinus, to knee pain, to sciatica, depression, frozen shoulder, you name it. We have everything here. I will be running with you through certain case histories which I have done on certain issues and how we have handled. A word of caution here, the asanas which are shown here are just descriptive. They are not prescriptive in the sense that I do not prescribe them on everyone, each and every one over here. It all depends. We have to examine the individual, see their physical status, mental status, and then so on and so forth. So now in front of you here is a gentleman who was having a disc prolapse, L4, L5, L5, S1. And when he came to me, he was in excruciating pain. So first thing what he needed was, before treatment, was restorative asana. And what you are seeing in front of you, I am putting him into a modified shavasana, where his feet are up on the stool and his back is flat on the ground, and I'm explaining to him how to release the curve of the back and make it flat on the ground so that the tensions on the lower back are minimized. And then concentrate on the breath to bring about relaxation. Sorry. Now this is the Supta Padungasthana. This is an extremely good asana for relieving tight hamstrings. On the left is the classic pose, which is there in all the yoga books. And we, Iyengar yoga trained people, modified the pose. And on the right side, you are seeing a modified pose where you are seeing the practitioner using a belt or a strap. With the aid of the strap, we have brought up the leg. The strap acts as a prop. Instead of stretching the hamstring more than 90 degrees, we have just used that to stretch it slowly. Of course, this is here 90 degrees. It can be 75, 45, whatever is comfortable for the practitioner. That's very, very important. So slowly, like we've had patients who've started like just about 2 inches from the ground, and over a period of a month or a month and a half, they've gradually brought up the leg right to the top. So this is one of the most important, because if you have tight hamstrings, you cannot release a tight back. This pose which is in front of you is Maricha Asana. The left one is the classic one. The right one is a modified one. It's a standing Maricha Asana, where basically you are using the principle of twisting and giving it to the patient so that he is able to twist his back again, not too much where the pain gets worse, but enough to bring in, to set in a healing tone to the whole problem. So here the spinal muscles are twisted to release the muscles which are very tight along the entire spine, and basically to make the spine more mobile, because normally it is seen that the thoracic region of the spine is very tight for people because we don't have too many exercises for the thorax. So this is the way it's done. Now on the left side again is a classic pose of Ardha Uttanasana. Uttanasana is full right touching down the toes. This is Ardha, that means half Uttanasana. And this cannot be done by a person who is in pain. So we again give them a forward bend. This is a partial forward bend which releases the caught spine, creates space in the vertebrae. For heal, because of a disc prolapse or a disc injury, the exit nerve root is being pinched, and we can help release that slowly through this pose. So the right side is a modified pose. Please note the alignment, what is there inside the pose. If you notice, the Feet are exactly shoulder width apart. Okay? See the knees, they're nice and tight. See the legs, it's straight. See the flatness of the back. This is to remove that lumbar roundness which happens in most of the people. And in this entire pose is like an inverted L. And this kind of precision brings about healing. Another common problem which we've seen with a lot of people is degeneration of the knees, or the arthritic knee, as we call it. So arthritis of the knee happens when the knee joints are compressed. And that always happens because of extra weight. These are all add-on problems, extra weight. That is never the only culprit. It happens because of no mobility, less mobility, or sitting in positions which are not good for you. And genetic reasons, there's so many reasons. Reasons are too many. So here what we do first is to create mobility in the knee joint first and remove the compression, we do something which is called the Virasana. This is the standing Virasana which we do, where we ask the patient to hold all the toes together and lift the leg so that the knee joint is nicely stretched. Any kind of inflammation you would have seen swelling in the knees is released beautifully through this asana. This is a variation of the first Supta Padungasthasana which you saw. That was the one where the leg was raised above 90 degrees, and this is raised sidewards laterally. Now again she is doing here with her hand. We are giving again the belt to the practitioner and doing it 90 degrees right. Of course, everybody cannot do 90, so we start from here, again 45 degrees, gradually work their way up as and when the healing sets in. Any questions so far? No? Yeah. Pose for the arthritic knee is Trikonasana. Now this is a perfect Trikonasana, Iyengar style. Do not miss the alignment. See the perfect triangle which is there. The front foot is extended 90 degrees. The back foot has been moved inward to an angle of 20 degrees. So we talk in degrees with Iyengar style asanas. And this opens up the pelvic joints, opens up the rotator hips. And then it releases the psoas muscle here to be able to extend the spine right up to the cervical region. Please note, now everything is in line. The shoulder, the hands are in line. The shoulder joint is in line with the cervical. The entire spine is in line with the hips. And the knee is in line again with the hip and the ankle joint. So this way what happens, this kind of stretch enables lot of space creation. And space is health. Now the same thing we are trying to achieve with a patient. We are giving them something which is called a slant board. Now this is a typical Iyengar style prop which is made out of wood. The idea to give this is to be able to open up the hip joint without stressing on the knee. If this was not there and if the foot was placed on the ground, the knee joint would have been stressed, and instead of relieving that pain, we would have aggravated that pain. So that's how this works. And same thing, we have the legs are here, as I explained. Of course, here the distance is short because the patient will not be able to keep this kind of distance. This is another one asana, the Virabhadra Asana 2, the warrior pose. Now in this, if you notice, this is a classic pose, Iyengar style done. Again, please notice the clean angles what you see, straight, 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 straight. There is no slouching, no bending, no nothing. The muscles are activated and moved. And here the leg is exactly at an angle to be able to open the hip flexors. Now the same thing, to use the benefit of this asana, we do it this way. Now this is the modified pose where we give support to the practitioner, to the patient, by inserting a chair just below her thigh. So we create this tabletop feeling of the thigh to give support there so that her hip flexors open and release the tight lower back muscles and the tight knee. Any questions? Everything you all have understood or nothing you all have understood? About low back, we've talked about knees, and this is very, very physical. Now I wanted to explain to you the mental, the psychological side of Iyengar treatment. So I have gotten depression. We characterize depression, we put depression not only as just one depression, one type of depression, just the way the medical world does. Depression is of two types, the Rajasic depression and the Tamasic depression. Now, what is the difference between both of them? The symptoms are totally different. We've seen that depression in women is more common. That's because that's come to light more often than depression in men. Depression in men usually comes out as symptoms of anger, frustration, irritability. Very common. I'm sure all the ladies who have husbands around 50 years of age will know that. You know, they start throwing things and showing anger and all kinds of things. And women's depression is more subdued. The crying types, oh, why me, what's happening, nobody's nice to me, nobody loves me kind of depression. So that comes under Tamasic depression, and the men's depression comes under Rajasic depression. And the way we approach the treatment of both is totally different. So we are going to first start with Tamasic depression. So Rajasic depression, excuse me. Now a person who is angry with himself, with events around him, with circumstances, with life itself, you know, his mind is racing. His heartbeat is always fast. He's agitated. So for that kind of a person, we need to calm him down first. So the best calming exercises are forward bends. We all know that. So this is a classic pose of Adho Mukha Virasana. Some people call it Shashankasana, child's pose. Child pose, the hands are behind, but yeah, Shashankasana. And this is a modified pose which I've done with a patient. Now she is lying down on a bolster with her hands extended. She's sitting in Virasana with her knees folded. We have different kinds of asanas for different people. If someone is not able to sit down like that, what we do is we insert a block or a cushion between the thigh and the calf. So there is a remedy for everything. All different kinds of bodies, different kinds of remedies. So for this lady, she was able to sit down nicely, so we've not done that. But we've given her this so that she doesn't have to go all round, and she's supported, and she's touching the center of her forehead down on the block, and that calms her mind. The moment you pull the skin of your forehead little bit towards your eyes, your mind starts calming. And Guruji has demonstrated that beautifully many, many times. So he used to talk about skin. Move your skin. When in depression, he used to say that, see the skin of the patient, the eye, skin of the eye. And those days we used to think, skin of the eye, Guruji, how are we going to do? And then we would get one smack and then we would stop asking questions, we would have to listen. So that kind of diagnosis is available if we care to look at it. If we only care to look at it. So everything is not there out in the books because somebody has written those books. So today we only evaluate a person by their degrees. 5 years in a medical college, he knows it all. 20 years in sadhana. So this is Adho Mukha Virasana. Okay. Virasana. Now the next one for Rajasic depression, this is Guruji himself. Please see the pose. It's like a marvel. And I think he was around 60 years of age when this was shot. Just see his body alignment. I'm sure we all cannot complain when we are in 40s to say that we can't do a pose. He's put his head down right on the floor, no props, no nothing. But we are not going to be that strict on the patients. So we give them a prop here in the form of a bolster to be able to go down and again calm their mind. Please note, see how they are supported with the ropes so that the back does not collapse. Only if the spine is erect, as Dr. Ananda said, not straight. We don't have a straight spine. We have only an erect spine. This pose can be achieved. Now we come to the Tamasic depression. So what happens to people who are Tamasic during depression? They do not want to get out of bed in the morning, the first thing. They want to take that quilt and put it on the head and believe there is no world around them. There are no responsibilities, no drama. They don't want to get into it. They are very happy being inside. That is also not normal, not natural. For patients like these, we need to get them out. We need to not let them involute. So for them, what we have to do, every physical part of our body corresponds to the mind. That's what Guruji said. You know, he used to ask us, have you ever seen a depressed patient like this? And we would laugh. Why? Because the moment your chest is open, your lungs are open, you cannot be depressed. A depressed patient is only like this. Slumped forward, shoulders caved in. Yes? So for a person who's depressed, we give them these chest opening exercises, Ardha Uttanasana or the half moon pose. This is the classic pose. This is the modified. Actually, this picture is not complete. There is a stand behind, which is called a trestle in the Iyengar system, a wooden trestle from which we take the support and so we don't have to be in the center of the room, and we open out. Just see this whole action. It's open. How many of you all have ever done a Ardha Uttanasana over here? What did you all feel? Just tell me, impromptu, what did you feel when you did the asana? What was the feeling here? Will I fall down? Will you fall down? Okay. Yes, ma'am, you have done. I just feel the stretch and the tension release. You felt tension release. Dr. Meena?
You feel more confident once you're able to do that because your shoulders are open and your chest is open.
Absolutely. Correct. You feel freedom. Yeah. It's like, I'm willing to fly. Yeah? So that's what this asana does for you, freedom. For a depressed person, that's the most important thing. You feel freedom. I am free. So this is how this works on your psychological aspect. Another chest opening pose is the classic pose of Ustrasana or the camel pose. This is how it is normally done. Of course, everybody does not have the flexibility, so we give them this chair. So if you notice, we have used all kinds of different props up till now, right from a strap, block, chair, trestle, which I didn't see, which was invisible. But yeah, this is a simple olden style chair which we use and give the practice. Just see how beautifully and ingeniously this has been used. The practitioner is up against the wall, so the front of the spine is nicely supported. The distance between the two calves is maintained like shoulder width, and only the chest and shoulders are open nicely. To lift the diaphragm, to make breathing possible, and the moment you breathe well, you feel good in the mind. Don't we all feel that? Didn't you all feel good after Dr. Ananda's exercises? Okay, wow, I'm like bright and up. That's what you feel. Okay, so these are some of the testimonials of clients whom I have treated. This is Dr. Srinidhi Chidambaram. She heads the Apollo, VP of Apollo Chennai, and she's a Bharatanatyam dancer. She had swollen knees because she's a dancer, and I treated her, and she's fine now. This gentleman is from Teni. So he was having this shoulder problem from 20 years. Bad posture was the only reason. Done everything, been there, done that, but got relief only because we made his postures proper, we corrected them, we realigned them, and then there was no looking back. I have been in this field of treating people now for many years, and some of the challenges which I have faced are these. You know, it's kind of very ironical that first, most of the time when the Western medical practitioners come, they first say that they look at us with doubt. Can you deliver? And so the doubt is very contagious. It passes on to the patients. And then they expect, will you deliver? No, we don't deliver. But then when they go everywhere else and they don't get treated, they don't get healed, they come back to us and then they say, you deliver. So it's like either I deliver or I don't deliver. So why can't I be the first choice? Why am I always the last choice? So if you don't have faith to me, why do you come to me at all, even at the last choice? So this is something which I've always felt. Confused patients. As I said, the doubt has been passed. It's like, I am confused, I am going to confuse the hell out of you. So patients are not sure. They want to believe you, but years of conditioning, years of pharma advertising, they are like, should I believe her or should I not believe her? Will she make me okay or will she not make me okay? So what I tell my patients, if you want something in your hand, you have to let go of what you are holding. You cannot hold two things. And only if they are willing and committed in the treatment, I take upon a patient. Otherwise, I tell them it will not work. You cannot work with a doubting mind. Skeptical and ignorant doctors. I have nothing against medical doctors. Medical science is very, very useful. Part of the whole seminar today is introducing yoga in the medical field, and I think it is very, very necessary, because I don't even blame the doctors, because in their 5 years of learning, they don't even know the whys for yoga. They have been only told everything is like only science and numbers and pages and control group and research group. So that is the challenge which we face. Actually, when I made this slide, I didn't know that this point is already going to be discussed earlier. But it is, yes, we don't need scientific proof. We just need direct experience. We don't need on any of that. Because a scientific proof has come from whom? From people on whom the test has been done. So unless something is documented, is it not the truth, is my question. You can't keep around documenting things all the time. If I'm so busy documenting, where will I treat my patients? But we don't want to believe one man who says, I'm treated by yoga. But you will believe if something comes in some journal somewhere, oh, it must be true. Why? I think I'm coming to the end of my presentation, and I just wanted to kind of, set the ball back into your court with the food. Don't answer me now, but please mull over it, because there has been a demand all over after the International Yoga Day has come that let's standardize yoga protocols and let's do this and let's do that. I really wonder, can you contain a science as like yoga into a box? Give it boundaries? Can you put air and contain it in one place? Some things of nature are so beautiful if just left free. Just like no two thumbprints are same, no two signatures are same, why do we want to why do we want to standardize a treatment? Why not customize it? The beauty, the essence of yoga is lost if we also start following the medical world. These standardization protocols are the biggest culprits. It's like, oh, you need this medicine, everybody has to have this medicine. I am not the decision maker, but this is something which goes on in my mind every time. I wish whatever I'm saying, somebody else, somebody important hears it and takes the decision. Thank you so much for a patient hearing. Thank you.
Detailed, scripture and explanation of the patients you treated, the different conditions, the positions pictorially shown and expressed very well. Thanks a lot. May I now request Ravi Shankar sir to please honor Fharzana.